Next slide. Thank you. So what do we mean by essential tremor? So we often associate tremors with diseases like Parkinson's disease, but what essential basically means is we don't know what's causing it. It's like it's built in to the person. And that's why we have terms like essential tremor or essential hypertension. It's usually not dangerous, but it can worsen over time and severely affect the life quality of life of patients. It's sometimes confused with Parkinson's disease, but as I'll explain later why this patient, uh, the tremor is not consistent with the tremor usually seen. So essential tremor can occur at any age, but most common people age 40 or older. Next slide, please. So the patient was a 65-year-old female who first consulted my private clinic July 15, 2024. Previously diagnosed with essential tremor. That part. We need to give with Western medicine. The patient's tremor, if you can see my hand, it's the whole hand. Like, okay, I saw it for my more.
Excuse me, we cannot hear you.
Tremor is sometimes noticed in rest, contention tremor, and then like so initially, like I do with most of my patients, I would treat with acupuncture first, and if necessary, add herbs later. That's because of both cultural and shall we say, accessibility questions. Chinese herbal medicine is not as easy to find, and good quality Chinese herbal medicine not as easy to find in the Philippines as it is in other places like Taiwan, Hong Kong, or mainland China, or even Thailand. Next slide, please. So initially, my uh, other than the only significant history, tongue was unremarkable, but pulse was deep and wiry, not exceptionally excessive. Initial points I used were, as I would use front and back. The objective was to extinguish wind and to nourish blood, but I didn't want to be too aggressive at first, so I used large intestine for Heku, liver treat Haichong, GV20 Bai Hui, GB34 Yang Lin Chuan, spleen 6 San In Chao, and then I used Functure Gallbladder 20, uh, Geshu Bladder 17, Danshu Bladder 18, Pishu Bladder 20, and Shanshu Bladder 23. Again, my objective was because I always follow the principle of if the blood is rich, then wind is naturally extinguished. This patient would often note exacerbation of symptoms when she has had a prolonged period of little sleep, either due to taking care of grandchildren or due to other problems that come about in the house. Next slide, please. So for the first two times that I saw this patient, there seemed to be minimal improvement. So I decided to prescribe Tianma Cotan. For the first 4 days after taking the medicine twice a week, there was a major improvement, but still occasional relapses. After I enumerate Tianma coating in, I will also enumerate what modifications I had made from time to time. So let's talk about Tianma Kotang in. Next slide, please. So I did not put the dosages anymore. I just like to talk about what the formula does. So it basically does what I originally wanted to do with the needles, which is to calm the liver, extinguish wind. It also helps to clear heat and, very importantly, invigorate the blood. Again, following the principle that if blood is rich, then wind is extinguished. And it also does so by tonifying particularly the liver and the kidneys. So this is a very well-known formula. But in this particular patient, I've had to modify it. Well, I'll tell later. So next slide, please. The main ingredients, we'll just go through this really quickly, is Tianma, heavenly hemp, which is known for extinguishing the wind, for calming the liver, very, very effective in stopping spasms and tremors. So very, very well known for that. And subdues rising liver yang. So if there's a liver yin deficiency, and the liver yang naturally rises up because yang goes up. And if there's no yin to hold it back, this one can help subdue it. A particular combination with Kotang and Shicheming and Tianma is known particularly for extinguishing wind. So that's our chief herb. And then our next herb would be, next slide please, Kotang. So interesting thing about Kotang is, as you can see in the picture, the hook shape in the branch. So it's also very particular in stopping spasm, and it's also very good in draining liver heat and pacifying the liver yang. So you can see that these two, either together or with other herbs, would also be very good for dizziness due to excessive wind, not dizziness due to blood deficiency alone. Next slide, please. Now, Shirchemi is a hard, heavy mineral. So in addition, and it's salty. So in addition to draining fire, it can help bring the yang down, because the idea here is it's heavy. It can help pacify, stabilize the mind and everything, and calms internal wind. Next slide, please. Now, Zhizi is very, very commonly used when it comes to the liver. It's it's a sea. It's very, very good in clearing heat, cooling and active, and getting blood to move. I just want to remember that the red color has to do with blood, and it also very, very good in the effective in the liver channel. So for liver blood in particular. So paired with Huang Qin, they clear heat and drain fire, preventing heat from rising through the liver channel. So that's the purpose of Zhizi here. The next slide, please. And Huang Qin, which is normally associated with draining fire, particularly from the upper and middle jiao. But in uh, in addition to that function, it's also very good in calming ascending liver yang. So combined with Zhizi, powerfully drains and clears lurking heat from the lungs. So that's based on um, a testimony by the great Li Shizhen that he had some lung infection that was treated by his father just with the Huangqin. But at the same time, so it also treats cough with yellow sputum, so a lot of excess heat, and epistaxis from heat going up to the head from the middle. So here it's used particularly for calming ascending liver yang, along with Chitze, which spreads the liver blood, cools down the liver blood. Next slide, please. Then you have Imo Chao. Again, uh, it does its function of preventing blood from rising up with the rising liver yang by invigorating the blood. Again, the same principle being, if the blood is rich and free flowing, then wind is extinguished. I think a lot of practitioners, what I'd like to emphasize here, a lot of practitioners are obsessed, at least I've seen in the Philippines, they're so obsessed with clearing wind that they forget to invigorate the blood. So that's one point I'd like to emphasize in this case. Never ever forget to invigorate the blood. Next slide, please. And Chuan Yoshi, again, expelling wind invigorates the blood again. And it's a common herb combination with tutong and shang to tonify and nourish the liver and kidneys. Because the liver stores blood and the kidneys are the source of essence from which we get the yuan qi for all the organs to transform food into blood, particularly that of the spleen. So next slide, please. Tutong is a very, very strong herb for nourishing the liver and kidneys. And again, you'll notice the pattern of using herbs to expel wind by invigorating blood. Next slide, please. And then Shangqi Shang nourishes liver and kidney yin, nourishes the blood. So this is a herb that's used in this formula for that as a secondary purpose. Again, the principle, which I must have said 5 times already, extinguish wind by nourishing blood. Next slide, please. And Ye Jiao Tang, again, nourishes blood and then, of course, calms the shen, unblocks the channels. With Fu Shen, it can also calm the shen and steady the will. Help them relax, help them sleep. Because if they cannot rest and sleep, then obviously you'll end up with the blood and yin deficiency. So it also treated that aspect of this patient's case perfectly. Sometimes they are too tired, so even if they try to sleep, they can't sleep soundly. Next slide, please. And finally, fusion, which is similar to fooling but has this wooden parts in it, pacifies the heart, calms the mind, and soothes the nerves. So for this particular patient, the first few weeks were fine, but if we there was one particular time where she had to take care of a sick uh, sister, and so even with the formula, her tremors were coming back really bad. So, and her tongue became pretty pale at one time. So I remember this was about 3 weeks ago. So I added a gel to the formula and it worked. The tremors went away. Since then, since her tongue has went back to normal, I've tried removing a gel and it's still working. But I've tried to remove the formula and deal with acupuncture. The tremors would come back. So I'm still in the process of trying to wean the patient off Kenma Kotanin, but it appears that the stresses in her life are still a little too much. 'Cause I don't want to give this formula for too long. Okay. So I would welcome any comments on what to do later on because it's working, but I want to get to the point where the patient doesn't need it. So I really appreciate some advice on that also. So thank you very much. Uh, thanks for listening.
Thank you, Dr. Chris. Very good case about Germany people. And does anyone has question? I have a question about the patient. The patient have uh, hypertension. Okay,
Yes.
okay. And then Doctor Professor like that. Okay, Professor Lai today is not here, and I think this case is very good example about tumor patient, and we can see the gamma protein have very significant effect about to treat some kind of this kind of patient. And according to the Dr. Philip point, because I think temagotin have some this temagotin have some drug some herbal medicine to nutrients about the yin. So in acupoint, maybe I will add the Tai C acupoint to improve the tremor patient. Maybe you can to conference to reference to reference my acupoint. Thank you. Okay. If no one have question, we will end this webinar. Okay, thank you everyone. Bye bye.
Thank you, Dr. Philip. Thank you. Next
Thank you.
case. Okay. Bye bye. See you.